I'd like to associate myself with the remarks of the senator from South Dakota who speaks so eloquently on the major issues facing our nation, the concerns for people all around the country, the quality of life, the cost of energy, the cost of their health care, the impacts of government regulations and rules that make it harder and more expensive for small businesses to add workers to their rolls. And I come to the floor today as a physician, a doctor who's practiced medicine in Wyoming, taking care of families there for about a quarter of a century, to do as I've done week after week since the health care law was passed, to give a doctor's second opinion about the health care law. Because one of the reasons I got involved in politics was, as a doctor, I was concerned for my patients, worried that they weren't getting the care they need from the doctor they want at lower cost, realizing the impacts of costs on the availability of care, the quality of care. And so when the health care law was passed, I had great concerns because I felt it was going to end up being bad for patients, bad for the providers, the nurses and doctors who take care of those patients, and terrible for the American taxpayers. And it was interesting during the discussion of the health care law when Nancy Pelosi, the then Speaker of the House, said that in terms of the health care law, first you had to pass it before you got to find out what's in it. Well, the law has been passed, and as more and more people are finally finding out what's in it, the law continues to be very unpopular. But it is interesting when a law is written behind closed doors, passed in the dark of night, when people on the side who voted for it actually never read it, didn't understand the implications, that here we are 2 years later with so many people still saying what's in it. And one of the things I wanted to visit about today, Mr. President, is an article, actually an editorial, in the New York Times from just a couple of weeks ago. This is while I was traveling around the state of Wyoming, visiting with people, visiting with former patients. An editorial came out with the headline, "A glitch in health care reform." A glitch in health care reform. Well, Mr. President, for 2 years I've been coming back to the Senate floor week after week after week, talking about things that were in the health care law, unintended consequences, things people didn't realize were there, didn't understand were there, were surprised to find out were there. And so the headline is "A glitch in the health care reform." Right under that, the subheadline is "Millions of middle-class Americans could be left without affordable coverage." And then my favorite line, the first paragraph, "Confusing language in the health care reform law has raised the possibility that millions of Americans living on modest incomes may be unable to afford their employers' family policies and yet fail to qualify for government subsidies to buy their own insurance." Confusing language. Mr. President, that's what happens when a law is written behind closed doors, not read by the people who vote for it, and the Speaker of the House of Representatives of the United States of America says first you have to pass it before you get to find out what's in it. And this, Mr. President, is an editorial in the New York Times 2 years after the health care bill has been signed into law. Confusing language, a glitch in health care reform. Millions of middle-class Americans could be left without. And so it is not a surprise that I will continue to come to the Senate floor with a doctor's second opinion, because we will continue to find where confusing language leaves people confused. Now, one of the areas that is so often discussed on the Senate floor is the Congressional Budget Office. Well, they came out today with a new report. It talks about the health care law. No surprise. They said they got it wrong a couple of years ago. They've re-looked at the numbers. This is the Congressional Budget Office, supposed to be an expert on making some assumptions and making some suggestions and some predictions. And today they came out with a report called "Payments of Penalties for Being Uninsured Under the Affordable Care Act." Now let's go back. Payments of penalties for being uninsured. Well, this is a health care law that reaches into every home in America and says you must buy a government-approved product. You must have health insurance. Not enough money to pay for doctors to care for patients, but plenty of money for IRS agents to investigate the American people. And what does it say when you go through the report? They said, well, they thought that there'd be about 4 million people that would have to be paying penalties for being uninsured under the health care law. Well, they were only wrong, they say, by 50%. They were off by 50%. Not 4 million, but 6 million Americans will be penalized and have to pay taxes under the health care law, as the Supreme Court found to be constitutional. Well, it may not be unconstitutional, but it is still unworkable, very unaffordable, and very unpopular. So I come to the Senate floor week after week as new reports continue to come out saying CBO was wrong, the New York Times talking about confusing language. You know, Mr. President, I would say James Madison, the father of the Constitution, had it right when he said you should pass no laws so voluminous they cannot be read, so incoherent they cannot be understood. But that's what Democrats in the House and the Senate did when they passed and when the President signed the health care law. Now, another report has just come out within the last couple of days, and I recall the President, when he was talking about the health care law, he said that computerizing medical records, he said, would cut waste and eliminate red tape. Now, what does the report say? Well, it says that the amount of paperwork, the amount of man-hours put into just complying with the rules and the regulations, they have come up, they are predicting, and I'll get into those who have done the prediction, that businesses and families will end up spending 80 million hours a year on paperwork trying to comply with this health care law. A former Internal Revenue Service Commissioner, Fred Goldberg, says that the current form of the Obama health care law, he says, quote, will be a needless administrative and compliance quagmire for millions of Americans. The Ways and Means Committee in the House of Representatives under Committee Chairman David Camp found that more than half of those 80 million man-hours will be consumed by small businesses. Now, that is the group that can least afford to have to spend this kind of time, this kind of manpower. You know, you talk about productive work and non-productive work, and this goes in the category of non-productive work. So either they're going to have to hire more people to just do paperwork, or take people from doing productive work and move them into the non-productive side. You're talking about 40,000 full-time people working the number of hours they would work to get you to this 80 million man-hours of work. It is wasteful. It creates no wealth overall to the economy. It is not a productive activity. So those are the things that we see week after week. And then finally, last week, there was a group of franchise owners who were traveling around visiting with members in Capitol Hill about the impact of the health care law on them and on their small businesses. And they want to hire people. They want to get people to work. We know that under the President's economy, there are 23 million Americans who are either unemployed or underemployed, people looking for work, looking for better work, looking for more hours. But let's look at the incentives as well as the consequences that are included in the health care law. Well, these small franchise owners, what they will tell you is that in order to try to comply with the law and not be driven out of business because of the expense of the penalties and the high level of insurance that they would have to provide to their workers, they only have a couple of choices. One of the choices, they don't like it, but one of the choices is to cut the number of hours that the employee works, because then they're a part-time employee and then they don't have to receive the benefits of the mandates of the health care law. That's not what they want to do. It's not what the employees want. They want to work more hours. But the consequences of what the Democrats in this institution have passed, the consequences are that people who want to work more are going to lose that opportunity. The other thing that they're looking at is saying, well, just drop paying insurance at all and pay the fine, pay the penalty, because because the consequences and the incentives are such that the fine is, from a business standpoint, the path to follow, rather than to provide a high level of insurance that the President mandates. But it may be a lot more insurance that the people want or need or that the businesses can afford. So I'll continue to come back to the floor, Mr. President, talk about the President's broken promises. He said if you like what you have, you can keep it. We now know many people who may like their health insurance aren't going to be able to keep it. He said the insurance rates would drop by about $2,500 per family a year. We've seen that the rates have gone up more than $3,000 a year instead of dropping $2,500 a year. The promises are many. The reality is quite different than what the President has promised. And that's why the American people continue to find the health care law unpopular. It's why our seniors, who have seen $700 billion of their Medicare dollars taken away from them, not to save Medicare, but to start a whole new government program for others. It's why they know it's going to be harder for them to find a physician to take care of them, especially if their doctor retires or if they move to a new location. And that's why I'll continue to come back to the floor to talk about trying to help people get the care they need from a doctor that they choose at lower cost. This health care law is bad for patients, it's bad for providers, the nurses and doctors who take care of those patients, and it's terrible for the American taxpayers. And that's why, Mr. President, I believe we need to repeal and replace this broken health care law. Thank you, Mr. President. I yield the floor.